Hi there, and welcome back to Senior Coach. This is a place where we help seniors live their best lives. Today, we are talking about one of the most serious medical emergencies that affects people of all ages. We are talking about strokes. If you or someone you know happens to have a stroke, time is of the essence. In this video, we'll show you exactly what you need to do to help save a life when someone has suffered from a stroke. Strokes are life-threatening events that can happen to anyone at any age. Therefore, it's crucial to understand what a stroke is, its signs and symptoms, risk factors, as well as causes. Knowing these will help you prevent and respond promptly in case of an emergency. So first off, what is a stroke? A stroke occurs when the blood flow to the brain is disrupted, leading to a lack of energy to the brain cells. When someone suffers from a stroke, they can end up with permanent damage or even death. One of the signs of a stroke is sudden weakness or numbness on one side of the face, arm, or leg. When this symptom manifests, it may cause difficulty speaking or moving the affected limb. This type of weakness is often the result of the blood supply being cut off to a specific area of the brain, which can lead to temporary or permanent damage to the affected nerve cells. Another sign of a stroke is slurred or abnormal speech. This sign may manifest as difficulty speaking, repeating words, or saying nonsensical phrases. This type of speech issue is known as aphasia and is caused by a damage to the areas of the brain that are responsible for language processing. A sudden severe headache with no known cause can be a sign of a stroke. This type of headache may be accompanied by other symptoms such as nausea, vomiting, neck pain, or confusion. Sudden vision loss in one or both eyes can also be a sign of a stroke. This may manifest as partial or complete blindness in one eye or as double vision. This kind of vision loss can occur suddenly or gradually and is usually accompanied by other symptoms such as headaches, dizziness, or difficulty in speaking. Dizziness or loss of balance or coordination can also be a sign of a stroke. These symptoms may make it difficult for someone to stand or walk, or may cause unsteadiness or a sense of spinning. They may also be accompanied by other symptoms such as headaches, vision loss, or weaknesses or numbness in one limb. It is important to note that not all stroke produce the same symptoms, and some people may experience only mild symptoms while others experience more severe symptoms. In any case, seek immediate medical attention if you suspect you or someone that you know is having a stroke. So what should you do in case you have a stroke? The first thing to do is call 911 immediately. This is a no-brainer. If you suspect someone is having a stroke, pick up the phone and dial those 3 little numbers, 911. The ambulance will get the person to the hospital faster, and the hospital staff can start treating them right away. When strokes are involved, time is of the essence, so don't delay. For instance, if your friend suddenly slurred their speech and their face started drooping, you should immediately call 911 and not wait for the symptoms to go away. A smile that's lopsided or drooping on one side can be a sign of a stroke. So ask the person to smile and see if their face is even. If it's not, this is a big red flag that something is up. For example, if your grandma starts slurring her words and her smile becomes uneven, you will know that she may be having a stroke and should call 911 immediately. If the person has trouble raising one arm or it drifts downwards, this is another sign that they may be having a stroke. So ask the person to lift both arms up to see if one arm seems weaker than the other. For instance, let's say you're with your grandpa and he suddenly loses strength in one arm and has trouble lifting it. You can ask him to raise both arms to check if he has difficulty with one arm. If he has difficulty with one arm, that could be a sign that he's having a stroke. Another thing you can do is to check their speech. If the person is slurring their words or is unable to speak, this is usually a sign of a stroke. It's important to pay attention to the speech and ask them to repeat a simple sentence like, "The sky is blue." If the speech is slurred or if they can't speak it at all, it's time to call 911. So let's say, for example, your neighbor suddenly starts mumbling and can't form coherent sentences. You should suspect that they are having a stroke and call 911. If the person is having a stroke, it's important to keep them calm and comfortable. Reassure them and make sure that they are lying down with their head and shoulders slightly raised. This helps to prevent any further injury and makes it easier for the ambulance to transport them to the hospital. So for example, if your friend suddenly becomes disoriented and confused, you will reassure them and help them lie down on the floor with a pillow under their head and shoulders to keep them comfortable as you wait for the ambulance to arrive. The faster the person receives medical treatment, the better their outcome will be. So therefore, it's important to take note of the time when the symptoms first appeared. This information is valuable to the hospital staff who are treating the person. For instance, if your grandpa suddenly experiences signs of a stroke, you can write down the time that the symptoms first appeared and share this information with the ambulance and hospital staff. The medical history is important information that the hospital staff needs to know in order to treat the patient effectively. If the person is conscious, ask them about any pre-existing medical conditions, allergies, or medications they are taking. If they are unconscious, try to locate their medical information and bring it with you to the hospital. This information can help the hospital staff provide the best care for the person. So if, for instance, your neighbor was having a stroke, you will ask them about their medical history and take note of any pre-existing conditions, allergies, or medications that they are taking. You can then share this information with the ambulance and hospital staff so that they provide the best possible care. And that's all for today's video. Remember, strokes are a serious medical emergency and it's important to act quickly. Keep the FAST acronym in mind, and if you suspect someone is having a stroke, don't hesitate to call 911. Thank you for tuning in, and don't forget to like, share and subscribe to Senior Coach for more helpful tips and advice for seniors.